So for the chronic complication of sickle cell, you need to know that the first of one is clear. Generally, you're going to have chronic hemolysis. Is it clear? Generally, first complication, you're going to have chronic hemolysis. So patients that are usually in sickle cell, they are usually going to be pale, they are anemic, is it clear? And the anemia is having an HB of generally 8 grams per deciliter. Is it clear? So they are generally pale, anemic, is it clear? And they have a tinge of jaundice. The jaundice is not going to be elevated. You have just a tinge of jaundice of icterics at the level of the eye. It tells you that this is going to be chronic hemolysis, and this chronic hemolysis is beneficial. Is beneficial to the body. Why? Because if you have too many red blood cells, that is red blood cells that can account more than 8 grams per deciliter. If you have red blood cells that can account more than 8 grams per deciliter, generally they are going to have occlusion because their blood is going to be highly viscous. That's why the body, in order to compensate from those occlusion, it tries to hemolyze more of the red blood cells. So you need to know that what this chronic hemolysis is actually very important to maintain the hemoglobin at 8 grams per deciliter, because too high hemoglobin account for very high red blood cells, and those high red blood cells are highly viscous that can increase the occluding crisis. Is it clear? Now, the second element after that, from the head, you can have a stroke. Is it clear? If you can have a stroke in a patient that is sickle cell. Now, the next one, you can have a chronic otitis media. Is it clear? You have a chronic otitis media at the level of the ears. From the head, you have a stroke. The ears, you have a chronic otitis media. Now, the fourth element, we now go at the level of the heart. In the heart, you are going to have a heart failure, and the heart failure is just as a result of the anemia. Is it clear? So when you have anemia for a long period of time, you are going to have heart failure. Now, you need to know that while you have model cardiovascular risk factors, is it clear? And those model cardiovascular risk factors, we need to know that the mnemonics is going to be high UPAC. Is it clear? For you to understand this model, mnemonics and the model cardiovascular risk factor, where anemia, that's A, anemia corresponds to, you need to go and visualize the tutorial on SchrDbb on diabetes, on the risk factors of diabetes. So we are going to have, so after the heart failure, the fifth element is going to be the case of the lungs, where you are going to have a pulmonary embolism. Is it clear? Pulmonary embolism, and the pulmonary embolism account from increased viscosity of the blood. Is it clear? And we also have a patient, generally you need to know that patients that are sickle cell, we have compensatory production. Since there is usually a chronic hemolysis, you are going to have a compensatory production of the white blood cell from the bone marrow. Is it clear? You have compensatory production of the red blood cell, from the bone marrow. Is it clear? Since there is a compensatory production, we are going to have what is also called thrombocytosis. Is it clear? Thrombocytosis in this patient. And since they have thrombocytosis, you have also other thromboembolic events. Is it clear? You can have other thromboembolic events in the case of, apart from pulmonary embolism, you can have other thromboembolic events in the case of sickle cell patient. Now, since the patient also are going to have excessive bone marrow proliferation because there's a chronic hemolysis. Is it clear? What happens is that since there is excessive hemolysis, there is excessive bone marrow proliferation. Is it clear? So the bone marrow is going to proliferate out of the normal bones that are producing it. Is it clear? So we need to know that what the general bones that produces are the long bones. Generally, the bones that produce the blood are the long bones. Is it clear? At the distal side of the long bone, the epiphysis of the long bones. Is it clear? And you have also at the central portion, the level of the ribs. Is it clear? At the level of the ribs also you have the production of the blood, and the level of the sternum also. But now, since the bone marrow here is going to fail because of the bone marrow is going to be excessively demanded, is it clear? You are going to have extra hematopoietic sites of the production of the blood. Is it clear? So extra hematopoietic site of production of the blood from the normal production site. So you are going to have sites like the parietal bone are going to start to produce the blood. Sites like the parietal bone, the temporal bone, is it clear? The frontal bone are going to produce blood. So that is what is going to result to bossing. And bossing is one of the appearance of patients that are sickle cell, meaning that you have boss, les bosses sur la tête. Is it clear? You have bossing. So you have parietal bossing, you have temporal bossing, you have frontal bossings. Those are the type of the bossings you're going to have. Also, you need to know that what the mandible can also start producing blood. Is it can start producing blood? That's what is going to result now to prominent incisors. Is it clear? In this patient, they have prominent incisors, and this is going to be called a prognathia. Is it clear? Prognathia. They are going to have prominent incisors that is going to be called prognathia. So those are the different elements that you have to visualize. Now, after visualizing at the level of the heart, the bones, the hematopoietic sites, you are going to have the next one. Number 8 is at the level of the abdomen. In the abdomen, you are going to have functional asplenia. You're going to have functional asplenia. And in functional asplenia occurs because of excessive hemolysis. Generally, you need to know that a patient at an age, children at age sickle cell at age of 5 years, usually their spleen is not palpable. Why? Because the spleen has already functioned for a long period of time, that is from 6 months, by hemolyzing the red blood cell, until the spleen now is tired. Is it clear? Now there is what is called functional asplenia. The spleen is not working again effectively. Is it clear? And the spleen is no more palpable. So that's why every time you have a patient that has hemolytic crisis after the age of 5 years, you should not think of sickle cell disease at first point. Is it clear? You should think it last, because generally patients that are sickle cell after the age of 5 years, they are not going to have a spleen palpable again because of this functional asplenia. Now this functional asplenia now prone them to be infected with encapsulated microorganisms. Is it clear? It prone them to be infected with encapsulated microorganisms. So we now come to another complication, which is infections. Is it clear? And that infection is going to be to the encapsulated microorganism. What are the encapsulated microorganisms you need to know? You are going to have meningococcus, or similar to Neisseria meningococcus, similar to Neisseria meningitidis. We are going to have pneumococcus. Is it clear? You have meningococcus, you have pneumococcus. Pneumococcus is similar to the Streptococcus pneumoniae. You are going to have Haemophilus influenzae. Is it clear? You have Haemophilus influenzae, particularly type B, which causes most of the infections. And then other, so these are the first ones. Is it clear? Then we have others like Salmonella typhi. They are prone to it. They are prone to infections with Salmonella typhi, which causes typhoid fever. Is it clear? And so those are generally the microorganisms that they are prone to. That's why among the elements that you have to prevent the reoccurrence of the crisis, you have to always give infections with vaccination to this patient against this microorganism. And